This program is about prehab before surgery, so preparing your knee for surgery. And doesn't matter what surgery you're going to have, the exercises that are in this program are going to help you gain full range of motion, get the strength back, get you moving as normal as you possibly can before going into surgery. I want to go over why prehab is crucial for recovering from surgery and how we know now that doing prehab is going to actually set you up for so much more success as opposed to going right into surgery or not doing anything up until having surgery. So we're going to go over a chart, and I'm going to share my screen with you guys so you can see what happens when you actually do your prehab before surgery. So you can see in this chart here how we have a line that's a non-prehab patient, that's in orange, and then a prehab patient, which is in blue. And we'll be able to see the difference. So we have prehab period, that's after an injury. They're doing rehab before their surgery. You can see the person that's not doing prehab is slowly declining, whereas the people that is doing rehab is increasing. So they're getting actually significantly better. And I find this interesting, but look at where they are here before their surgery. And they're still recovering after that post-surgical phase. They're not even to the point where they were prior to their surgery. So sometimes when you do prehab, you actually can prevent having surgery altogether because you're actually getting to the root cause of the issue. And sometimes that surgical procedure is actually not even necessary. So going on to the surgical procedure, obviously there's going to be a decline. You're going through surgery. Surgery is a major event. It is trauma to the body. Does not matter how prepared you are, it's still going to be trauma, right? So we see the non-prehab patient declines pretty rapidly and goes below the prehab patient. So the prehab patient declines, but not as severely as the person who did not do prehab. Then we go into the rehab phase and the post-rehab phase. So this is when you're doing your PT right after a surgery. You can see they're increasing kind of at the same rate, but you can see this prehab patient didn't decline nearly as much as the person who did not do prehab. So they are light years ahead of the person who didn't do prehab before surgery. So there's a lot of times people will say, well, aren't I going to hurt myself more if I do prehab before surgery? No, not at all. You are preparing yourself to be able to recover better. If you go into surgery with not full range of motion, inability to bear weight down on your leg, you can't move normally, you're losing muscle rapidly, imagine how much harder that's going to be to recover after you have surgery. So if you gain that full range of motion back, if you gain your strength back, and you are walking normally, moving your body normally, you're going to recover that much faster. So here are some main principles that we like to make sure that you're ready for surgery. So this is readiness for surgery. We want to get your inflammation under control. So if you have a bunch of inflammation, your doctor's probably going to say you're not ready for surgery. They don't want to go in there with all this inflammation. They want you to get that inflammation down before they go in for surgery, because surgery is going to create that much more inflammation. Range of motion achieved. We got to get you back to your full range of motion as best that we can, unless you have some type of physical block that needs to be removed with surgery. Gait pattern normalized. We got to get you walking again, normal, without a limp. Motor control, so getting that mind-body connection back, because when you have injury, muscles turn off. So you will have limited mind-body connection because their signal has stopped, because your body doesn't want to be in pain. So it's smart. It shuts those things off. Now, when it shuts those things off, those things become very weak, and you lose control over the way that you move, your stability, all that kind of stuff. So we got to get that mind-body connection back. Then comes strength, improving your strength to the best of your ability before your surgery. The stronger you are going into surgery, the better you're going to recover. And then all of this is going to increase your confidence. Imagine you've gotten rid of your inflammation, you've increased your range of motion, you're walking normally again, your mind-body connection's there, you're getting stronger. You're going to be way more confident going into surgery than if you didn't have any of these things, right? So the whole point of this program is to get you prepared for surgery so that you can recover even faster. And maybe, best case scenario, you don't need surgery at all. That would be great, wouldn't it? So I'm excited for you to dive in.